Well, many of us struggle with a good night's sleep, but disrupted sleep could be the sign of something a little bit more serious.
That's right. Joining us this morning to talk about sleep apnea is Dr. Bart Farrell and Dr. Waheed Mohamed from Carolina's Center for Oral and Facial Surgery. Good morning to both of you. Thanks for being here today.
Thanks for having us.
First off, let's start with what obstructive sleep apnea is. How would you explain it?
It's a condition of either decreased breathing or lack of breathing at night. It not only affects decreased oxygen to the brain, but it affects your heart, and it's really hard on the body. So over time, you start to break down. The worst or the biggest factor is usually excessive weight. But it affects 11% of males and 7% of females, but just leads to a high mortality or morbidity.
You know, one of my roommates played football with, he had sleep apnea. So what are some of the signs I would be looking for with sleep apnea?
So some of the common signs you'd see is snoring, daytime sleepiness, mood disturbances, personality changes. Men can experience impotence, and about 48% of men, they'll experience impotence. You can get bedwetting. And then a lot of people complain of waking up with morning headaches.
Now, how do you diagnose sleep apnea?
Well, usually a sleep partner is the first to show signs.
Right.
It's usually like loud snoring. But you can have daytime somnolence or just generalized fatigue. And when that happens, you can go see your primary care physician. They can help direct you. Most sleep medicine areas can diagnose and treat, and even in our office, we have cameras that we can use to look at the upper airway to see if there is an obstruction of the nose behind the palate. So if you look, we have imaging in our office. This is a CT scan, and we can actually quantify before and after surgery to look where the level of obstruction is.
You mentioned excessive weight can be a cause of it. Can folks of normal weight also suffer from sleep apnea?
Absolutely.
Okay.
Absolutely. Even pro athletes suffer from this condition, and it's very prevalent. And we've seen athletes get treated for it.
And some of the treatments too, because I live with a person with sleep apnea. They used to wear a mask. He used to wear a mask. What is that? Is that the first line of defense? Tell me about that whole process.
Yeah, so therapy can be conservative or surgical. With conservative therapy, usually they'll get devices, oral or nasal appliances, that help keep the airway open. The gold standard is a CPAP of conservative therapy. And what a CPAP is a nightly mask that's worn that helps apply pressure to the airways to keep the airways open. The drawback to that is people often tend not to tolerate it. It's difficult wearing something on your face every night and having the machine make noise. The newer ones make less noise, but still having to carry that machine around or have that machine is a little bit challenging, and that's where surgical therapy comes in.
All right, talk about when surgery. That's also an option for treatment.
And so as surgeons, we offer surgical therapy. You can have surgery on the nose, you can have surgery on the palate, you can have surgery on the jaws. There's an example on the camera there showing the surgery before and after. It takes the upper jaw and the lower jaw, and also the tongue base, and it advances those tissues. The end result is an airway that's significantly increased, but it's increased permanently because surgically everything's been moved. And so surgical results will give you changes or improvement in at least 95% of people.
Wow, that's good results. Let's take a look at some of the results in your surgery patients. We can show the video right here.
Sure.
Look at this before and after. That blows my mind. That's remarkable.
Yeah, absolutely. It's a huge change. It can be life-changing for sure.
I mean, they look completely different.
They do, because they are hard and soft tissue changes that form. You see an aesthetic change as well, and most of the time it's for the better, but primarily it is an airway corrector.
I mean, it really does change lives and affect their overall health, everything. You can learn more about sleep apnea by visiting mycenters.com, mycenters.com, or call Carolina's Center for Oral and Facial Surgery. The number is on your screen. It is 704-347-3900. Again, 704-347-3900. Good work, guys.
Thank you. Yeah, thank you.
Thank you for being here this morning.
Appreciate
it. All right, ahead on Charlotte today this morning. Get your body in shape for spring. It starts with the foods you're eating, the best nutrients for your body this time of year.
And my man Larry Sprinkle is here with our Tuesday Tail Wagger. Stick around.
So cute. The dog's not bad either.
You never know what's going to happen on Charlotte Today. Don't miss out. Watch it live or anytime on your DVR.